experience the strongest radio allowable by law. Secrets will be revealed. Myths dispelled. From the studio gym where excuses never apply, it's Superhuman Radio with your host, Carl Lenore.
On many, many shows, I've referenced a physician in Florida who is doing intra-articular growth hormone injections, having amazing results, regenerating cartilage in joints. Welcome to the show, finally, Dr. Allan Dunn. How are you, sir?
I'm fine, and I'm glad to be on the show. And good afternoon to everybody.
Yes. And, you know, I've talked about you without knowing who you were. Here you are today, and I have so many questions for you, but the first question I have to ask you is, how long ago did you first start experimenting with intra-articular growth hormone injections?
Well, the concept started in medical school when I was studying pathology. It's the second year in medical school. And we got to a chapter on endocrinology or hormones, and I read about acromegaly.
Right, giantism, bingo.
And I noticed, and I read that all the joints enlarge in acromegaly. The knee joint, the spinal,
the fingers,
disc,
everything, yeah.
Fingers, and it was very interesting that how could people start growing again after they've stopped growing, say, at the age of 18, which would be the normal age that you would stop growing.
And in fact, the phenomenon is called joint crowding that occurs in those who suffer from acromegaly, where the cartilage continues to grow and get thicker and thicker until it starts to cause internal pressure, right?
Well, that's the problem with acromegaly. That's a pathological condition. So I thought maybe I can grow cartilage with a smaller dose that's controlled and get a result without any of the side effects that you're talking about, the excessive growth. Controlled growth is what I aim for, and that's what I'm getting, and it has no side effects.
And you realize now, my audience is listening to this, and they know what I'm about to say. But you realize now, those of you who are listening, that Dr. Dunn is a doctor who did not abandon critical thinking once he got out of medical school. This is, you know, this little nuance here is really important to understand, because there's lots of physicians who are aware of what the side effects of acromegaly are, but not many of them go, wait a minute, if too much growth hormone causes this type of crowding, then what would some growth hormone do just to help regenerate chondrocytes? And I applaud you for that. I'm being sincere. And I'll tell you something else. For those of us who are experienced within the professional bodybuilding community, we know that bodybuilders who use sometimes between 10 and 20 IUs of recombinant growth hormone a day as they are preparing for competition suffer from joint pain that is a result of this same phenomenon, the overcrowding of the joints. So when taken systemically, it acts on all of the joints in the body. But what you decided to do was, what if we just inject it right into the capsule of the joint, right?
That's correct, into the joint cavity itself.
When did you do your first trial of this procedure?
Well, the first trial was in 1997. Dr. David Howell was the professor of rheumatology at the University of Miami. And he somehow became aware of my work, and he invited me to come to his office to talk about it. And I told him what I was doing. He said, my wife has severe arthritis in her ankle. And he said, do you think it would work on my wife? So I said, let me see the x-rays. So he showed me the x-rays, and I said, well, I haven't used it on anyone else. You can try it. So Dr. David Howell got his his supply of growth hormone from the professor of pediatrics.
Right, because they use it for
growth hormone is used to help youngsters grow to normal height
when they suffer from idiopathic short stature. Exactly.
Right, correct. So he got she couldn't walk across the room when we started treating her. So he apparently treated her. He never called me back because I'm just a local practitioner according to him, and he's a famous professor of rheumatology at the university.
Right.
So I don't count, right? So I figured, look, this guy is not treating me with respect. Let me call him. So I called Dr. David Howell, who's now my big friend, and I said, how's your wife doing? He says, my wife, she's able to walk 4 to 6 blocks now. She has no pain. He said, should I continue treating her? I said, yes, you've gotten this good result. Let's do a little bit more. So the same thing, he didn't contact me. And after, I would say about 2 months, I call him again. I said, you didn't give me any follow-up on your wife. How's she doing? She's playing golf.
Wow. I
said, she's playing golf. I said, that's terrific. He says, that's right. He says, it's working fine. He says, it's absolutely amazing. She couldn't walk across the room, and now she's able to play golf. She doesn't walk around the golf course. She uses the cart, but he says she's doing remarkably well. Well, that's the first patient, the wife of the professor of rheumatology at the University of Miami.
So when did you actually perform your first trial, your personal where you oversaw and you handled the whole process?
Well, shortly thereafter, we applied to the FDA, and we got FDA approval. And I spoke to the powers that be in the FDA. You know, they have different people at different levels, and they said, you know, growth hormone is very powerful. He said, well, we'll permit you to give 1 injection a month for 3 months.
Oh.
You know, you don't argue with the FDA,
right.
especially when you're a solo practitioner and you don't have any political pull or anything. And I said, fine, thank you very much.
Yeah, it's a starting point, you figured, right?
Of course. So I started treating patients. We had a group of patients, I don't know, about 20, 25 patients. And they started coming to my office, and I started giving them their 1 injection per month for 3 months.
How much? What amount of growth hormone did you inject into the joint? Just curious.
It's I was using at that point the genotropin,
right?
And it was 5.8 milligrams, but
so that's about 15. That's about 15 IUs.
The actual amount is 5 milligrams. The 0.8 milligrams is just in the preparation.
I stand to be corrected, but I believe that's about 15 IUs of growth hormone.
15 international units.
Right. So a single dose, 15 IUs injected into the joint. Were they all knees? Were they all hips? Did you try to stay with one joint?
Just, at the onset, just knees.
Okay.
Even giving one dose per month for 3 months, I had unusually good results.
Okay, I don't want to. This is radio, Dr. Dunn, so we have to make the listeners stay for the next break, the next segment. So here's what we're going to do. We're going to take a quick commercial break, and when we come back, I want to talk about the results, and I want to talk about the different pathways. We're talking with Dr. Allan Dunn. Don't run out and get that joint replaced just yet. Wait until you hear the rest of this interview about intra-articular growth hormone injections. You're listening to Superhuman Radio. We'll be right back.
Hey guys, it's time to change your f***ing underwear, and it's time to change to Sheath. Sheath's Underwear's revolutionary designs allows your man parts to hang the way they would naturally hang if you were not wearing underwear. And this improves the blood flow throughout the day to the twigs and berries. If you've never experienced wearing a pair of Sheath underwear, boy, is there an exciting experience waiting for you. Grab a pen and write this down. Go to shrnetwork.biz/sheath. That's SHEATH. And use the code SUPERHUMAN to save 20% off your first pair. And get this, if you're not completely satisfied, send them back for a full refund. That's shrnetwork.biz/sheath.
For 17 years, I've heard promises of devices and gadgets that could eliminate chronic pain. I live with chronic pain. I live with sciatic nerve pain. It varies from just annoying to debilitating. I love to ride my motorcycle. I ride it every day if I can. And obviously, my motorcycle doesn't treat my lumbar spine good. I got the Kylo patch and I promised to give it a try, but I got to be honest with you, I thought it was bullshit. But I did what I was instructed. Find the right spot over the pain. You'll feel the pain start to go away. Leave it there and go about your business. And I did that. And that day I got on my motorcycle and I rode for about 3 hours. It was a Saturday. I came home that day, got off my bike and had no back pain. That's rare. In fact, it's impossible. How could that be? Well, the technology is legit. And I can tell you right now, if you give Kylo a try, you'll find that you don't have to live with chronic pain. Check it out. Go to shrnetwork.biz/GoKylo. That's GOKAILO. Use code SHR30 for 30% off. There are lots of concerns about food supply today. That's why you need White Oak Pastures. White Oak Pastures will deliver food right to your doorstep. You don't even have to go out and be disappointed by shopping in grocery stores. The finest beef, pork, lamb, duck, and more can be found at White Oak Pastures. And now they even have seafood. And best of all, White Oak Pastures has a negative carbon footprint, which means that you don't have to feel guilty for eating your ribeye. Go to shrnetwork.biz/white oak and use the code SUPERHUMAN to save 15% off. Hey, this is Carl Lenore. I am the inventor of Gun Leash. Over 500,000 handguns are lost in the United States every year. If you carry a gun like I do, you are 300 times more likely to lose your gun. And 15% of those guns will end up in criminals' hands and used in the commission of a crime. Gun Leash solves that problem. Gun Leash is a patented, no-tracking proximity device the size of a postage stamp. It will alert you as soon as your gun is outside of your range, so you can never leave your gun behind. To learn more and to be notified when Gun Leash is available at the end of January, go to gunleash.com and get on our mailing list. Gun Leash. Never lose your gun, never leave your gun. BPC is one of the most amazing supplements you can use. It's been shown to increase the speed of recovery, heal the gut, and do so many other things. BPC stands for Body Protection Compound, and it's a naturally occurring peptide in the body. Used by professional athletes and weekend warriors alike, there has always been an obstacle in the way of average people using BPC, and that is it was injectable only. Not any longer, thanks to NutriNeeds. We now have oral BPC, and it works. Go to shrnetwork.biz/NutriNeeds, NutraNeeds. Use the code SHR and save 10% off your bottle of BPC. Feel better, recover faster, train harder. NutriNeeds.
Get stronger. Feel younger. It's Superhuman Radio.
So, you were giving these individuals intra-articular injections in their knees of a single dose of 5 milligrams or 15 IUs, and you actually saw results occurring. Over what period of time? Did you see it right after the first month when they came back for their second injection?
That's correct, yes.
Wow.
You could see it within 3 to 4 weeks. That's right. I took x-rays, and they demonstrated increased thickness of the cartilage, space between the bones, and the patient's symptoms were reduced considerably, and everyone, I didn't have any failures, and I didn't have any side effects because I use a very small amount of growth hormone, and there were no side effects like you would see in acromegaly.
Well, and I want to ask you a question. Is it my understanding that in the case of the synovial capsule of the knee joint, that it is predominantly avascular? So really, a lot of this injected growth hormone would stay localized in there, would it not?
Well, I did studies with animals. The growth hormone remains in the joint for about 4 hours. And then over the next 18 hours, it seeps into the general circulation. And then it's excreted in the urine, basically.
Right. So when the growth hormone is in the joint, did you take a look at downstream metabolites? Do we know if the beneficial actions are directly from the growth hormone, or is its conversion to IGF-1 or IGF-1E, which is mechanogrowth factor, or was it just the growth hormone itself was stimulating chondrocyte production?
Well, there is the possibility that it produced the IGF-1, but I think it was a direct action of growth hormone on normal chondrocytes. But even more important, if you read the developmental healing of cartilage, you will then see that the growth hormone has a very important function in that it can convert normal adult blood vessels, which are like garden hoses, and they're solid and they have thick walls, into the developmental vessels, which are called fenestrated capillaries. Fenestrated means that they'd have holes or windows in the capillaries, and the capillaries are very filmy and have a thin wall, usually one layer as compared to 4 layers in an adult. And in these fenestrated capillaries that the growth hormone produces, they form stem cells.
Right.
And these stem cells are the very identical stem cells that your body uses to create the skeleton and the joints when you're in your mother's womb and when you're a child. So it's more than just a simple process. It's really it's extraordinary. It's a biological and natural process wherein the growth hormone actually rejuvenates adult vessels to form fetal vessels.
I was just going to say, it sounds to me like it switches on neonatal gene sets to do this.
Well, you may be right. I don't want to agree with you or disagree because I'm not familiar with that, and it sounds whatever it is, it's really quite remarkable. And if you read go to the website, Developmental Healing of Cartilage, you can actually see the formation, the change from adult vessels into fetal vessels, and the formation of stem cells, which then produce chondrocytes in a new joint surface.
Wow, that is exciting. And is that a result again of growth hormone or growth hormone? One of the metabolites of growth hormone. One of the metabolites of growth hormone is vascular endothelial growth factors.
I don't have the resources to study that, and I don't have a group of an army of scientists to do that. It would take, I would imagine, a dozen or more scientists to work on that, showing additional pathways. But the remarkable result is that the growth hormone does indeed rejuvenate adult vessels to form fetal vessels, and then you produce your own stem cells. And when you produce your own stem cells, there's no problem with rejection or anything. And the thing that I think is even more remarkable, and no one is I've been trying to impress certain groups to use these stem cells to do other things, to produce other tissue, because I think these would be pluripotential stem cells. So theoretically,
you could
be able to produce heart tissue, lung tissue, and everything else by injecting growth hormone into your knee joint.
And then
you might be able to produce stem cells, which can then do numerous other things. But I can't get the medical community to latch onto that. Maybe you can do that.
But the discussion, just getting the discussion out there can have that effect. This is amazing. So basically, the knee joint could become the incubator for you to produce stem cells, undifferentiated, pluripotent stem cells,
Right.
but that would be accepted by your body because they were built in your body, and then they could extract them, harvest them from the knee, and they could put them somewhere else.
Exactly. Hey, I like your thinking. You are absolutely correct. When I wrote my first article, Morphoangiogenesis, in 2002, that was one of my main paragraphs, because just curing arthritis is nice, but if you could cure heart disease and lung disease and kidney disease and other things with these stem cells, that would be certainly a major advance in medicine.
Okay, so now a question. So we there's a lot of people in this audience, and there's some of us who are athletic types, and many have gone for hip replacements because they're older. I'm 55. I've got a good friend, Mark Joseph Dome, who lives in Texas. He's a bodybuilder who had to go for hip replacement surgery recently. He's getting up in age. Could this therapy not be used as a first-line treatment before saying something radical like we're going to saw the facing of your joints off and put these cobalt joints in for you?
That's the whole point of this treatment. It should be the first line of treatment. If it doesn't work, there's no side effects. You can always go forward and do the major joint replacement, which is, as you say, cutting out the bone in the joint.
Why aren't
putting in metal and plastic?
So why aren't I mean, 1998, my goodness, there's been more than enough time for other physicians to go, wow, this guy, Dr. Dunn, he's got something here. We should be doing this too for some of our patients. Why are we not seeing this? Instead, everybody's rushing to put in prosthetic joints.
Well, I don't have a good answer, but I know during orthopedic residencies, there's practically no education with regard to biology, and they're still in the 19th and 20th century. They haven't quite made it into the 21st century, and most of the internists and the other, which I think are the brightest of the bright physicians, are all interested in stem cells and producing new ways of treating people. The orthopedists are still treating people the way they did 50 years ago.
Yeah, and I agree with you 100%. And I tend not to be a conspiracy theorist to the heart, but I sometimes think that these therapies are being overshadowed because there's so much more money in hip and knee replacement today, and everybody's getting them because of the diabetic nature of. We know, we've done shows on the fact that it's not mechanical loading of the joint that causes this wear. It's the constant low-grade inflammation that people live under that causes the degradation of these joints. So if in fact someone was going to do this clinically, obviously you wouldn't opt. Would you opt for the once-a-month protocol? Take the lowest.
My patients could not tolerate it. They were getting so frustrated. They were climbing over me as though I were the one who were creating this
blockade,
fence.
right.
And I asked around, and I said, what can I do? The patients are driving me nuts. I said they can't stand it, and I don't blame them. They said, oh, you can do it off-label. So there are 31 states in the United States that permit off-label use of various medications and hormones such as growth hormone, if you can demonstrate that there's a beneficial effect, and you don't have to go to the FDA or anything like that. So I've been doing everything with off-label use, and I can give up to 2 injections per week to speed up the process, and everyone is now smiling and happy. And I'm happy, and they don't bother me.
Are you doing the 5 milligrams each injection, the 15 IUs each injection?
Yeah, I am. Yes.
Do you have
the hips are rather large, so I give them 10 milligrams, which would be about 30 international units.
Are there any joints that are not good candidates for this type of therapy?
No, I've used it on shoulder joints.
What about the spine? What about the spine?
Joints.
What about the spine?
I don't want to start injecting the spine. It will, in acromegaly, the spinal discs grow 25% in height, and it would definitely work in the spine. But I don't want to use it in the spine without doing some animal studies.
Right.
So I've been trying to convince. There's a wonderful neurosurgeon. I'm not a back specialist at Mount Sinai in Miami Beach, and he's very interested, and he's very interested, and he's very interested, but he
hasn't taken the plunge yet, right?
Yeah. He hasn't taken the plunge yet. That's right.
I want to plug your primary website, IAGH.com. The acronym is for intra-articular growth hormone.com, IAGH.com. If you're a clinician and listening to this show and you want to either learn more about this for your own use or you want to consult a Dr. Dunn or even send him patients, go to IAGH.com. I mean, to me, it is an atrocity to remove a joint and put a piece of metal in a person's body when you have something like this to go to first. I'm sorry.
No, I agree with you, and I can't convince my my orthopedic colleagues because they don't know anything about biology. When I explain what I'm doing, they look at you, I don't know what you're talking about.
Well, as soon as you say growth hormone in this day and age, you're immediately cast aspersion because you're talking about a drug that has been talked about in Major League Baseball, and it's like, oh no, we don't want to do that.
Of course, I don't use it for any of those.
No, I understand.
Ulterior motives.
Of course, but the point being, as soon as you say the word growth hormone, you pretty much could put a lightning rod on your head and walk out in a storm because you're going to get zapped. Here's what we're going to do. We're going to take a quick commercial break. I have lots more questions, Dr. Dunn.
Of course, I'm here. I'm happy to answer them.
We're talking with Dr. Allan Dunn. I have referred to Dr. Allan Dunn, not by name, but by this physician in Florida who is helping people avoid the need for knee replacement surgery. And we're going to come back and talk more with him. Stay tuned. You're listening to Superhuman Radio.
Merrick Health is a premium telehealth platform that connects customers with partnered providers from the comfort of your home. Merrick provides concierge service with your very own patient care provider as your health advocate. You'll go over all your needs and goals from improving sexual function, hair loss prevention, increased muscle, fat loss, and overall improved performance. Prescribed treatment options can be ordered and shipped directly to you if you meet the requirements. All from the comfort of your home. Go to shrnetwork.biz/Merrick Health. That's MAREKHEALTH and order your comprehensives and get 10% off with code SHR. Don't forget to add the lab analysis to have results reviewed with potential over-the-counter supplements or treatment recommendations. That's shrnetwork.biz/Merrick Health and use code SHR at checkout. Or order your own desired labs with code SHR and get 10% off your first lab order. Remember those rectangular toaster pastries you used to love when you were a kid? Well, Legendary Foods has just made them better. The new cake-style tasty pastry is like nothing you've ever had before. With 20 grams of high-quality protein and less than 1 gram of sugar, you'll feel like you're cheating, but you're not. Go to shrnetwork.biz/legendary and use the code SHR10 to save 10% off your purchase of tasty pastries. Now available in cookies and cream, red velvet cake, birthday cake, blueberry, strawberry, brown sugar cinnamon, and hot fudge sundae. Go to shrnetwork.biz/legendary and use code SHR10 today. Great sleep upgrades you on virtually every level. Body fat, muscle mass, mood, brain function, and countless other ways. But taking melatonin alone isn't the answer. Thanks to a brand new sleep formula developed by my friends at Bioptimizers, you can experience the best night's sleep ever. Sleep Breakthrough is a delicious sleep drink that supports your natural melatonin production and relaxation without creating a dependency so you can have the best night's sleep on demand. It targets 5 different sleep pathways to give you the best sleep ever. And best of all, you'll wake up feeling rested and rejuvenated so that you can have the best day possible. For an exclusive offer for my listeners, go to sleepbreakthrough.com/SHR and use the code SHR10 for 10% off. Plus, you can unlock special gifts with the value of at least $20. This is a limited time offer, so go to sleepbreakthrough.com/SHR right now.
Dogs should be powered by fat and protein, not carbs. That's why Visionary Pet makes low-carb, ketogenic dog food for dogs of all breeds and life stages. From kibble to freeze-dried and even low-carb treats, all Visionary Pet recipes are very low-carb, ketogenic, and made with 100% real meat protein. Shop now and use code SHR for 20% off your first order today. Your dog deserves the lifelong benefits of optimal nutrition. Make the switch to Visionary and see why smart dogs eat low carb.
Build muscle, burn fat. It's Superhuman Radio.
Dr. Dunn,
Yes.
we know that one of the metabolites of growth hormone, IGF-1, is both a powerful anti-inflammatory and antioxidant. This is one of the way growth hormone, IGF-1, has been implicated in producing or increasing the growth of tumors is not just by stimulating growth, but also by reducing reactive oxygen species, which has the ability to kill and also suppress certain tumor necrosis factors. And so we know that there's a push-pull benefit from growth hormone. It's not just helping things grow, but it's kind of taking the brakes off at the same time by quenching reactive oxygen species and suppressing inflammation. So with that being said, does it make sense to combine the growth hormone with something else? I know low molecular weight hyaluronic acid injections have some benefits in increasing synovial fluid. Does it make sense to say, well, we're going to make a cocktail, growth hormone and these other things, to create the best environment for the joint as we do this?
Well, the Korean made a study in animals, and what they found was that when they used the growth hormone with hyaluronic acid, it worked. But they didn't use they didn't compare
to a placebo
without the hyaluronic acid.
Right.
Hyaluronic acid would have no bearing on the effectiveness of growth hormone.
Right.
It works. Growth hormone. If you think of like an army, the growth hormone is the general, the 5-star general, and everything else works under its. They would be the corporals and the lieutenants and everything else.
Right.
They're not. They have nothing to offer growth hormone, which is of itself the major hormone that's
calling the shots, so to speak.
Calling the shots, yes.
Yes,
okay.
yes, I got you. So there really is no advantage to make a cocktail or anything like that.
No, there's just definitely no advantage.
Okay, now in the states where growth hormone, where a physician can use growth hormone off-label, 33, I think you said 33 states?
31, as I understand.
First of all,
I can't name them, but
I know.
I know there's 31.
I'm sure there's a way to find them on the internet. But when a patient comes to you, well, let's say they live in Florida, so it's easy for them to come to you for regular, twice a week, whatever. How much does it cost to have this therapy done, and for what length of time do they have to do it before you are satisfied with what has now occurred in the joint?
Well, it's as follows. If I inject the shoulder, it only takes about 6 or 8 injections. If I inject an elbow, it takes about 4 to 6 injections. A wrist also takes 4 to 6 injections. If I do a thumb, the base of the thumb is something that is very disabling to people.
Right.
I've treated some hairdressers and things like that.
Repetitive, yeah, right.
And it only takes 4 half doses to grow the cartilage back in the base of the thumb, and they're completely pain-free, and they're able to resume any activities without any problem. Then we go to for instance, the lower extremity. Hips, I haven't solved the problem with hips. About 50% of them do well, and I have to give them 10 milligram injections. When they do well, it's fantastic. When they don't do well, nothing is. There's no side effect. You just don't get any result, and you can always get a hip replacement. As far as knees, we've done studies on knees of 66 patients with severe osteoarthritis in their knee, and now, if there's bone on bone in the knee, I generally have to do arthroscopic surgery to remove the covering, which is called eburnated bone. Eburnated bone is like eggshell.
Uh-huh.
It's very thin. It has no blood supply. It has no reason to be there. It covers over the underlying healthy bone. So what I have to do is do an arthroscopic procedure, which is an outpatient procedure. Go in the morning, go home in the afternoon.
Right.
And I use something like a dental burr, and I remove the eburnated bone and expose the underlying bone, which is called subchondral bone, which is spongy bone, and it has blood supply in it. And as soon as you remove the eburnated bone and get down to the blood vessels, you get a little bleeding, and that it exposes the adult vessels, which can then be converted to fetal vessels by the growth hormone injections. Mm-hmm. And I've been very successful with knees. I'm speaking about the 66 patients. 87% of these patients, they all needed total joints, and only 13% actually ended up needing some form of joint replacement. 87% did not need any. They were doing fine. They walked, they talked, they played golf, they played tennis, and they did really well.
Right.
Without any further surgery, and no side effects. Now, when you do a total joint, you can get blood clots, you can get pulmonary embolism, you can even die from it. I know one of the.
You mean when you do a joint replacement? You're talking about?
Yes, when you do a joint replacement, there can be very serious side effects.
Yes.
And even death, you can die from a joint replacement.
Well, never mind the fact that, forget about that. Never mind the fact that you now have this foreign object in your body that we already see what's happening with some of the individuals who got the hip replacements that had the cobalt and the metal prosthesis.
Metal on metal,
and they've got cobalt poisoning in their bodies now.
Right, they have. It affects their kidneys. It damages their kidneys. Damages their lungs.
That is that's by far one of the most radical procedures in the world. To have somebody go in and saw a piece of your skeleton off and put a piece of metal in there instead. When you think about that, it's just shocking to me.
It sounds barbaric, doesn't it?
Yes, it does. Okay, so
when it's done properly, it does work, but they do wear out and they do have problems. And if you get an infection with any total hip, a total knee, you're out of commission almost a year. You have to have multiple surgeries. They have to take out the prosthesis. They have to put in a bolus of cement that contains a lot of antibiotics.
Right.
They have to put a special line, special so you can get intravenous antibiotics for 6 to 8 weeks. They have to put a plastic tube into your chest, into the vein in your chest, in order to get antibiotics 3 times a day for 6 to 8 weeks. Mm. And I mean, it's a total disaster. And luckily, when you get an infection, it's generally 1 to 2% of your population, even in the best places.
Right.
My own, fortunately, I've only had 2 infections in the last 30 years. It's amazing. I think it is due to my personal hygiene.
Yeah. Okay. Okay.
I mean, simple things like I always wash my hair before I go into the operating room. And I always take a shower before I go into the operating room, and I don't touch anything, and I don't, and I'm extremely careful in the surgery. But that's given me a record, probably one of the best records in the United States. 2 infections in 30 years.
That's amazing. That is amazing. Before we go into this break, one real quick question. Does insurance cover this, or they don't even cover this sort of stuff, the intra-articular injections?
It does not cover the injections. It does cover the consultation, the x-rays. It covers the surgery, covers the follow-up, but it doesn't cover the injections. The injections are each injection, and the price, I don't know why the price went up, but the cost of the hormone has been going up over the past year for reasons unknown. Now each injection is $450, and if you need 10 injections, of course that's $4,500. If you need a few more, you just add the $450.
Yeah, but you want to know something? Keeping your own joints, it's like keeping your own teeth, keeping your own joints, and not having to turn to a prosthesis just because your insurance company will pay for it, in my humble opinion, is well worth the price of admission. We have to take a break. I have a question when we come back.
Sure.
That just dawned on me about, and obviously I'm not well educated. I host a radio show, but I have an idea of why some of the non-responders are non-responders. I want to talk about that when we come back. We're talking with Dr. Allan Dunn. If you are a clinician or you are faced with joints that are starting to wear out, if you're like me and you squat heavy and you exercise a lot and some of these parts are wearing out, it would be very, very wise to at least consult with Dr. Dunn or have your physician consult with Dr. Dunn if you're lucky enough to live in one of those states where off-label use of growth hormone is available. This could save you from needing a prosthesis. In my humble opinion, avoid that prosthesis at all costs. Stay tuned. We'll be right back.
Jumping higher, lifting more. It's Superhuman Radio.
Okay, so Dr. Dunn, as you pointed out, the individuals with the hip problems and even some with knee problems, there are some non-responders to the therapy, correct?
Correct.
Okay.
Yes, you'd expect that, but there are no side effects even if they don't respond.
And that's why it should be a first-line treatment before anybody goes and says, hey, we got to replace a hip or replace a knee.
Absolutely. You're absolutely right.
But what I was thinking about was, we live in an environment today, they call it the obesogenic model. And I'm not just talking about obesity here for a second, because there's a lot of people who suffer from what I'm about to describe that can fit into a size 32 pants or a size 4 dress. But their body is a hotbed for inflammation, chronic inflammation. And so we know that the deterioration of these joints is more linked to the response of inflammation in the body than mechanical loading. We've actually done shows about this and some of the linkages to omega-6 fatty acids, the American diet, exposure to certain toxins, and so on and so on. And the message here is that inflammation can deteriorate these joints. So one would have to believe that, and you correct me if I'm wrong, in order for a therapy to be effective, the therapy must either suppress the insult or the insult must be removed first. Because if the insult and the therapy equal 1, then the net results is 0 because they counteract each other. So the therapy has to be a 3 and the insult has to be a 1, or 1 and a 0. But the bottom line is I'm willing to bet, if I ever get to Florida, lunch, that these individuals who are non-responders are non-responders because the scales are tipped in the opposite direction of what you're trying to achieve. They have such great inflammation in their bodies that the inflammation is maybe killing off the stem cells or reversing the beneficial effects of the growth hormone before it can actually do its thing, because they are a hotbed for the destruction of their joints and chondrocytes.
Well, you may be very. That's an excellent thought that you have. I have no proof of it, but it sounds as though it should be looked into and studied to give them anti-inflammatories before they get the growth hormone.
Yeah, because and that's why I was wondering if there's a cocktail. So Dr. William Seeds and I have actually talked about this. We know IGF-1 directly has an anti-inflammatory response, and growth hormone does cause a downstream metabolite of IGF-1, but that may or may not be happening in the joint. That may happen only in tissue. So they do have IGF-1 long R3 now, which is a long-acting form of growth of IGF-1 that has a half-life of 7 hours. It attaches to serum albumin, and it has a half-life of 7 hours. They also have pegylated mechanogrowth factor, which has a half-life, I think, of about 12 hours. And it would be interesting to see if the growth hormone, accompanied by these two traditional metabolites, in and of itself would help to shift the inflammatory attack on the joints off. And then the other thing that's exciting, and you may be aware of this, but they now, while I do not think this is good physiologically for a person to use, they now have a long-acting growth hormone that is just starting to pop up on research on the NIH website that has an 8-day half-life in the body. Now, I think this is a big mistake for people who are looking for any type of therapeutic benefits from growth hormone on a physiological standpoint, because growth hormone has a rhythm and it must be adhered to. Otherwise, the body is going to go bonkers. But if it's injected in the joint and it has a longer half-life and it can stay localized longer, I don't know, can you use epinephrine to localize it and keep it in the joint? Then you would have almost like a growth hormone turbocharge that would maybe be more effective in fewer doses.
I can't answer the question, but I'm aware. Actually, 3 or 4 years ago, they started using, or they've developed a long-acting growth hormone, but the mechanics of that may have impaired the actual function of growth hormone.
Yes.
So the fact that the growth hormone stays in the body doesn't mean that it's physiologically effective.
Right.
For 12 hours. It just may it may be attached to some type of protein or some type of mechanical which they use microspheres and things like that to keep the hormone in the body. But if it's attached to microspheres, then it's not doing anything physiological. It's in the body, but it's not working at all. So, I mean, it would have to be studied, and it'd have to prove to me that there's physiological activity over a 12-hour period, not just the fact that the hormone is in the body, which is meaningless.
Well, and I agree with you 100%, and that's why I think that it's a mistake to even use this for frank growth hormone injections, because the body expects growth hormone to appear and disappear very quickly, and its downstream metabolites to do the rest of the work. And having something that is so contrary to the way the body expects it to be, in my humble opinion, could actually cause problems and not work effectively. So you're saying exactly what I've always felt. Listen, if there are listeners out there and or clinicians who are looking to start to offer this or want to see if their doctor can help them with joint problems using this therapy, is contacting you adequate? Do you work with other physicians to help them along with this sort of thing?
I sure would, of course. I even have some people now coming from South America who are interested. So I'm trying to get more people interested. And whoever is interested is someone who's of interest to me.
Well, I think that you've done a great service from the standpoint of being involved in the medical orthodoxy and actually finding something very beneficial for people, and why more doctors are not picking up the baton and running with this one is beyond me. And I just hope that more and more doctors start to look at this seriously as a first-line approach to joint degradation repair. Really. Great job. And I'm so glad that I finally got to talk to you, and now I know who you are.
I want to emphasize again, especially for clinicians and scientists, to read the Developmental Healing of Cartilage. That's the other website I have.
I'm trying to find it. It's the Developmental Healing of Cartilage. That's the website?
Just Developmental Healing of Cartilage.
Okay.
It should come up, and it shows one of the programs that I presented at some of the national orthopedic meetings with photographs and things like that.
Excellent. Thank you so much for being on the show today, Dr. Dunn.
I really appreciate the opportunity. I hope everyone benefits from it.
I think they will. Even if one person out there avoids a hip replacement or a knee replacement, we've done our job. Thank you so much.
Great. Thanks so much.
Take care.
Have a great day. Bye-bye.
We'll see you tomorrow with more Superhuman Radio.